Hello, this is Kyle again, and today we're going to talk about movement planes and their applications to training. So, as we dig into movement planes, the easiest way to categorize these are the three different categories. So, we look at the sagittal, the frontal, and the transverse planes. And as you're kind of looking at these, they differ in how they divide the body and segment the body. And the easiest way to describe and categorize, the function of these is how people move and orient themselves in space, right? So the sagittal plane divides the body into left and right halves. The frontal plane divides the body into front and back halves. And the transverse plane divides the body into top and bottom halves. And on the next slide here, we've got a few pictures that'll kind of outline this for us in a little more detail. Visuals are always helpful. So as we look at this one, we look at the frontal plane, and we're going to be divided front to back. We've got the sagittal, and it's going to bisect right in half, right to left. And then we've got the transverse, which is going to bisect the top to the bottom. And then this next picture over here, we can kind of look at how this even creates almost a quadrant system, top to bottom, on how the body is going to be, moving in space and functioning. So when you look at how the trunk is rotating, or how the arms are abducting, adducting, flexing, and extending in space, we can kind of have a better idea of what plane of motion we're actually moving in as we go about our exercises, and how we can maybe even better choose those exercises for our clients based on their needs. So looking at the sagittal plane first, this is typically considered the least complex of all the movement planes, and this is where we look a lot at just general flexion and extension actions and patterns, right? So exercises that fall into this category are typically performed bilaterally and are stationary in nature. So we're looking at vertical displacement rather than horizontal displacement. So a lot of the bigger movements that you're thinking about that we typically, again, describe as sagittal are going to be squats, hinges, presses, right? Shoulder flexion, pulls, shoulder extension. Those would both be bilateral, for this purpose. And then trunk flexion and extension. And we can look at a few pictures here outlining some of these exercises, but we've got here a conventional deadlift. Again, it's going to be predominantly sagittal in nature. We're going to talk a little bit about, just joint rotation and things of that nature as we get, deeper into this. But if we look at it from a global pattern perspective, this is going to be more sagittalized. We look at a crunch or a leg lift, and we're going to be looking at, again, trunk flexion, both bilaterally, two legs and two arms at the same time. So not contralateral or ipsilateral in movement. So that's going to be more of a sagittal exercise as well. And then we're looking at bilateral rows and bilateral presses. And again, as we get into unilateral loading, that's going to change just a little bit. We'll talk more about that in the frontal and transverse. But if we look at two arms moving in unison on a stable rib cage, we're going to be typically discussing more of a sagittal exercise application from that perspective as well. When we get into the frontal plane, this is going to be a little bit different. And this is where movements are typically going to utilize lateral flexion extension, lateral shifting of the rib cage or pelvis, or lateral flexion and extension of a limb, right? So exercises falling into this category can be bilateral or unilateral in nature, and can be stationary or locomotive in nature. So now we can look at both horizontal and vertical displacement. So you can see things like lateral lunges, different lateral hip shifting, gait-related exercises that drive hip shifting, like a front foot elevated or a rear foot elevated split squat, single leg RDLs, and then we've got lateral flexion and extension of the limb. So just like a lateral shoulder raise for the deltoids is going to be considered, in the same category as well. And as we're looking at this, so now we'll be looking at even a sumo deadlift. So this is going to be a bilateral vertical displacement. But if we look at what's happening to the actual femurs as they're extending and flexing, we're actually looking at a lot of adduction happening as well. So because we're utilizing a ton of adductor magnus and glute medius here, rather than some of those more sagittalized muscle groups like your glute complex and your quads, we're actually going to move this into more of a frontal plane exercise from that perspective. And again, I've seen this categorized as both, but this is an easier way for us to kind of separate those two between the conventional and the sumo. Here's an example of a lateral lunge. So again, this is where you see a hip shift over an instep. And this is going to be driving a ton of femoral internal rotation and adduction to go along with that flexion. And then we're going to be looking at just a side plank again, and this is going to be a little bit of lateral flexion as well, driving that rib cage off the ground, and then shoulder flexion directly out to the side, right? So we're going to be looking at, again, a frontal plane application from that perspective. When we get into the transverse plane, now we're going to be looking at the most complex of all the movement planes. And these movements typically utilize rotation or counter rotation actions and patterns. So exercises falling into this category can be bilateral or unilateral and can be stationary or locomotive in nature. They leverage axial rotation or counter rotation. So you've got, limb rotation happening as well. You've got shoulder hip, right, that are ball and socket joints. And then you've got the wrist, ankle, and cervical spine that are going to be able to rotate on an axis as well. And then you've got bilateral axial rotation where the rib cage and the pelvis move together. So think about somebody swinging a golf club or a baseball bat. And then you've got unilateral counter rotation where the rib cage and the pelvis rotate against one another. So this is going to be more gait related things where we're running or we're sprinting. So this is going to be a trunk rotation, right? So we've got a pretty stable pelvis here, and we're rotating a rib cage on it, right? Just getting a little bit oblique, so oblique twist. Now we've got things like sprinting, where now we're looking at contralateral flexion and extension patterns that are going to be, again, much more counter movement in nature. We've got, if we look at Usain right here, we've got external rotation of a rib cage on the and flexion on the right side, and we've got flexion of the left femur happening at the same time. We've got shoulder extension, we've got hip extension happening here. So we've got a pelvis that's rotating this way towards us on the left, and a rib cage that's rotating towards us on the right. So we've got a nice big X pattern here where we're looking at that rotational aspect of the rib cage, thorax, and axial skeleton. And this is going to be counter rotations, right? So we've got rib cage and a pelvis doing opposite things. So it's going to be contralateral as well in nature. So as we get into this is where, we're looking at the transverse plane and rotation happening probably at a more granular level. But it's very important to also understand that, we've got our global planes, but then we also have things happening at joint actions, and understanding that rotation happens at all joint actions, right? So everything is going to be transverse from that perspective. So even levers that are traditionally thought of as sagittal also leverage rotation during flexion and extension. So if we look at the hip and the shoulder, they're ball and socket joints, right? So femurs rotate on the acetabulum, and the humerus rotates within the glenoid during flexion and extension. The knee and the elbow joints leverage rotation as well. So the radius and the ulnae rotate on the humerus during flexion and extension, and the tibia and the fibula rotate on the femur during flexion and extension as well as on the actual ankle. If we look at how they, they integrate with the calcaneus, as well as we go through dorsiflexion and plantar flexion. And then the ankle drives rotation as well. So the tibia and fibula rotate on the talus during dorsiflexion and plantar flexion. And the calcaneus inverts and everts as the foot supinates and pronates. So there's rotation happening at all these joints, even when we're moving in the sagittal plane through flexion and extension. So again, looking at how these things are built, we've got a scapula with the glenoid. We've got the head of the humerus. We're rotating through, right? And then in a very similar aspect, we've got a pelvis, we've got an ilium or an innominate happening. We've got the acetabulum here, and then we've got the femur and the thigh bone connecting into it. So we've got the femoral head inserting into the acetabulum to facilitate more rotation as we're going through flexion extension patterns. So these are going to be really common, and this is going to be a structure that facilitates rotation to accomplish flexion and extension. And then even as we look at how the femur operates with the tibia, we've got rotation and counter rotation that's happening during flexion and extension, depending on what angle that we're looking at, and depending, again, what's happening down at the foot, right? So we can also rotate the tibia on both the ankle and the femur as we're going through flexion, extension, and dorsiflexion and plantar flexion. right? So again, we've got the tibia sitting on that talus, and then we've got the fibula. We're going to be rotating through as we go through dorsiflexion, internal rotation during dorsiflexion, external rotation or plantar flexion. During that, we're also going to have inversion and eversion of the actual calcaneus happening too. All right, so when we think about movement planes, it gets really confusing, but these are some things that we tend to think about. Is the traditional model, where we just talk about the three big planes, is useful for organizing global patterns, right? So we have a sagittal, we have a frontal, and we've got a transverse, right? We've got vertical integration, we've got horizontal integration, we've got rotation is typically how we would describe that. But it's not useful to describing movements that are happening at the joint level because rotation is being leveraged all the time, right? So gait and locomotion based activities are inherently going to be transverse, as both the rib cage and pelvis are internally and externally rotating on the axis during strides, right? And they're counter rotating as well. So these are things that even though we're walking in a straight line, even though we might be able to be bisected from right to left, we're still going to be looking at rotation happening because different things are happening on both sides. There's always going to be a rotational component there. So thank you for listening on this. Again, we're going to talk more about this as we get into gait further along in the actual program.